Fernando, we'll go ahead and turn it over to you. Thank you.
And good morning. My name is Fernando. As I said before, I am the Climate Disaster Resilience Manager in Americares for the Americas region. I work with Nate. He's my boss. So I'm glad to know everyone, each one of you, and I'm glad to be here. I'm based in San Juan, Puerto Rico. So today we're gonna be talking about climate. We'll be presenting on clinic and health center resources for community preparedness for heat. This presentation will support the work that you already do, and we would like to thank you for doing the impactful work you do every day. This presentation is about extreme weather, preparedness, and tools that Americares can offer to you so you can get ready and stay prepared in an easier way. As you may know, heat and smoke and flooding and are no longer rare events, right? But today we're going to be focused on extreme heat resources. They are now part of our routine care conditions. And we know that when a heat wave hits or smoke settles in, staying indoors is not an option for everyone. So that's why we bring to you these resources. But before we go deeper into the resources, I would like to talk about our mission. Our mission is to help people and communities around the world access health in times of disaster and every day. Americares support local health centers, helping providers meet the needs of their patients and communities in times of disaster and every day. A deeply collaborative organization, we have an unrevealed network of local, national, and international partners. Americares supports over 4,000 health centers in the US and around the world as well. So our focus, we know that weather events don't just affect health directly, they also disrupt appointments, outreach, medication access, and definitely the trust. That's why extreme weather preparedness is fundamentally about quality care and equity, not just emergency response. This is not about predicting every emergency, but definitely it's about reducing preventable harm to your patients. So let's talk a little bit about the climate resilience for frontline clinics toolkit. Definitely weather events don't just affect the health directly, as I said before. But we're gonna give you some resources that we definitely have for you and your clinic so you can stay better prepared and you definitely can planning for these events. So just give me a second, sorry again. Okay, so these resources we're gonna talk about in right now, it meet the needs for frontline clinics and health centers at the patient they serve. These resources are for providers, patients, admin, but also for the community. And the next slide, we're gonna see some examples. And you can planning for hazards like general weather guidance, heat, wildfire smoke, flooding, and hurricanes. So heat is the deadliest weather event in the US, and that's one of many reasons why Americares bring these resources to the clinics. As I said before, the toolkit provides material for patients, providers, and administrators related to extreme heat preparedness. The materials are translated into 5 languages and contain a lot of infographics. The toolkit also includes guidance that goes beyond existing materials to provide evidence-based, useful, and accessible information and planning guides to help providers talk with their patients about heat. And in your screen, you can see some examples that you can find in the toolkit to provide guidance to your patients. So please, I would like to encourage you to take your cell phone, scan the QR code in your screen, and you will have access to the Climate Resilience for Frontline Clinics Toolkit. Also, you will find this in our page, in one of our webpage, americares.org. you can go under the tab What We Do, and you will find the toolkit as well. Another resources we have for the clinics to stay prepared is the Heat Health Action Plan. And this plan provides the foundation behind this project. This was developed recognizing the unique role of the clinics and the health centers, because all of you are a trust source of information, understand the patients, conditions, understand barriers to provide care, and you are the regular contact with those most vulnerable. So what these action plans are? These plans are a customizable resource tailored to your clinic or your health center based on an assessment you can complete. It will outline steps you can take to be prepared and to respond to patient needs. And now in the next slide, I will talk a little bit more about this customizable plan. So as you may see in your screen, this assessment will ask you information about your clinic. For example, the name, location, type of facility you are. Also, it will ask what type of interventions you implement or what actions you take during extreme weather events. Your staffing levels, also if you consider your clinic or health center to be under-resourced or adequately resourced in regard to funding, what high-risk group you serve, also how you partner with community organizations and what resources those community organizations provide to help you. And once you answer the questions, you will get a customized action plan for your clinic or health center. As you may see in your screen, the photo, you will get a 5 recommendation intervention for your clinic. So this short assessment will help you identify your clinic or health center needs, strengths, and your areas, and also will provide you information so you can improve your preparedness and areas related to heat, but also other hazards such as wildfire smoke or flooding. And this plan will be generated in just 5 to 10 minutes once you including the time starting from asking the question to generate the plan. And also each intervention in your plan include real world examples to show you how other clinics and communities have put these strategies into action. So the Americares Toolkit is a key resource by local public health departments, emergency department agencies, and community partners are also essential. And we encourage the clinics and healthcare centers to identify internal champions who can help sustain this work over time. Preparedness is a form of care. It's extreme weather. Preparedness is patient safety work. Extreme weather is becoming more routine. So these strategies and these resources we bring to you today is for you to stay ready, and together definitely we can help you out if you need some more information or if you need any kind of technical assistance. Please reach out to us to resilience@americares.org, and definitely we're gonna be more than happy to help you out with these resources. Any questions?
Fernando, thank you so much for that. For people who have not used these resources before, they are phenomenal. And congratulations to that whole team for helping to make them even more adaptable and tailorable to the communities. So way to lead on this, you guys.